Welcome to the January Virtual Learning Lab NHSN Annual Survey. My name is Christine, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. I will now turn the call over to Diane Dohm. You may begin.
Hello, everyone. Welcome to our third Virtual Learning Lab. We're glad that you could join us today. So just a couple housekeeping items to kick us off. I want to remind you of the resources available, including the slides for this call. Links to those as well as other resources should be in your chat box. We'll stop a couple times during the call today, essentially to allow time for questions, but feel free to use the chat box throughout the call to ask questions. You can ask for a step or a process to be repeated. You can request that I slow down. This call is really for you, so help us make it as useful as possible. Finally, as with all our previous webinars, when you close out of today's event, you'll automatically be redirected to an evaluation. Please take a moment to provide us feedback. Upon completion of that evaluation, you'll also receive a certificate of attendance for your records. By the time we're done today, our goal is that you will be able to enter your 2016 facility survey and your reporting plans for 2017. Just a reminder for those of you who aren't quite at this point yet, we believe you'll still find this webinar useful as we will review other steps as well. If you have not received your SAMS card yet, please continue to work with your state contact to complete the process so that you will be able to participate in this collaborative. Again, we want to remind you of the many resources available to help you with entering data into NHSN, including these on the LSQIN webpage, including the reporting guide, the frequently asked questions, and recorded versions of our webinars and previous learning labs. In addition to those resources available on the LSQN website, there are also many resources available on the NHSN Long-Term Care webpage. One that you may find particularly helpful is the table of instructions for the annual survey, and that link should also be in your chat box. We'll come back to these resource pages at the end of our webinar and actually go through some of these resources as well for you, but I want to leave as much time as possible to get through the webinar. So just to review a couple of the new changes with the version 8.6 update that NHSN just did on January 7th. You may remember our previous discussion regarding testing done on formed stool versus unformed stool. Now, although we all know a test should not be ordered on formed stool, on an occasion a provider will order such a test. NHSN has made it clear that a documented formed stool does not meet the criteria for a CDI lab ID event. Now, the key word here is really documented. If it isn't documented that the stool was formed, the assumption is that it was a correct sample and it was an unformed stool. Most labs also have a rejection policy in place and wouldn't accept samples that don't meet the guidelines. If your lab has such a policy in place, you can assume that any positive results came from appropriate specimens. If they don't have a rejection policy in place, we encourage you to have a further conversation with them encouraging such a policy. Your state contact can assist you with resources to aid in that discussion as well. And just to point out, too, that this is an excellent opportunity to educate your staff and providers regarding the proper testing for C. diff. If a patient's stool does not conform to the shape of the container, it should not be sent for C. diff testing. And this is really in order to avoid false positive testing. Also, a good reminder for your providers that you should not be doing testing as a test of cure. Often we see that as well. One of the other points that they cleared up with the 8.6 changes is that specimens obtained for C. diff testing when a resident has gone to an emergency room or other outpatient setting during a resident's current admission are eligible for lab ID event reporting if the event meets NHSN definition. So let's talk a little bit about what during a resident's current admission means. If a resident goes to the ER or to a clinic for a doctor's appointment and returns to the nursing home, it is considered the current admission at that nursing home. If the C. diff test is ordered and is positive, it should be reported as an event as it meets the definition. So it is not simply a matter of where the specimen was collected, but really where the resident is currently admitted to. So I just want to take a moment to check the chat box. Are there any questions regarding that change before we move on? Emily, is there anything in our chat box?
Nope, I'm not seeing anything come through.
All right. Remember, you can ask that question. You can always come back to this at a later point as well. But that question has come up from several of our nursing homes. Also, one thing that's happened for some of our nursing homes is if you need to make a change in your facility's NHSN administrator. The best thing to do on advice from NHSN is to send a letter on facility letterhead with this information signed by your CEO or nursing home administrator. Now, ideally, this should be done prior to the previous administrator leaving because you want your new administrator to have their SAMS card before the old administrator sends this letter because their access to NHSN will be pulled upon receiving this letter. So you can see here in our example, you want to put in the name of your organization, the date, the fact that you're requesting an update to the facilitator, the administrator, you'll put in the contact information for the new administrator and then fax it to the number on the bottom of that slide. Again, this is a good time, too, to contact your state lead if you have any additional questions regarding how to change your NHSN administrator. When you log into SAMS, you'll see it has kind of a new, updated, sleeker look to it. Not a lot of changes, per se, in how it functions, but more just how some of the screens look. The website there, hopefully you save that as a favorite. That will make it the easiest for you as we go in, and we'll be going right into NHSN in a few minutes to do that as well. So I'm just going to come back to that one. So some of the information that you are going to need for your 2016 survey will be the same as your 2015 facility survey. So let's go into NHSN so that I can show you how that looks as we talk. Just pardon me while I get into the right screen here. All right. So as always, you're going to click on NHSN reporting because your facility has already been enrolled. My username and password has defaulted in. If you need to enter yours, this is where you would do it. You then have to have your SAMS grid card available. You're going to put in the intersections at these 3 points that it's asking for on your grid card. These are unique to your grid card. Nobody else's card is going to work. I entered them correctly, so it's going to take me in. Now my screen is perhaps going to look a little different than yours. Again, we have access to a demo site for your facility. If you only have one component that you're working in, long-term care, that's going to default in. If you only have one facility or group, that will default in. If you are with a facility that perhaps has more than one facility, you will see a drop-down menu there. You need to make sure that you're choosing the correct one and pushing submit. So you'll see that when you open it up, you're going to see this message saying that there is a survey required for 2016. Think of this as a end-of-year summary survey. And when we talked about essentially printing your 2015 survey for reference. So we can go over here to survey. We would go to find. From the drop-down menu for our facility, we would put in 2015, click on find, and the facility will come up that was entered in. You can then print that form and then start to review those things that have changed. The other thing I think you'll find helpful is to print a paper copy of the survey prior to entering into NHSN. That will give you a chance to collect all the information that you will be needing so that you can enter it into NHSN at one setting. NHSN does not allow you to save a partial survey, so having all the information to complete it in one session will make your job much easier. I'm going to go back to our slides for a moment. And we'll be coming back to our NHSN website in a minute. And this is the link also in the chat box for the printing of a paper copy of the annual survey. So some of the data that you'll need to collect prior to completing the survey that you may not have at your fingertips. For the calendar year ending December 31st, 2016, you'll need to know what was the average daily census, what was the total number of short-stay residents, that's defined as a resident who stayed in your facility less than or equal to 100 days, what was the total number of long-stay residents, again that's defined as a resident who stayed with you greater than 100 days, and what is the total number of new admissions. Where can you get this information? That may be different in every facility, but check with your billing office, your business office, perhaps IT can run a report for you. Definition for the total number of new admissions. A new admission is defined as a new resident entering the facility for the first time or as a readmission if the resident was out of the facility for greater than 2 calendar days, meaning there had been a change in the admission date. So this is information you want to pull, again, before you go to enter your survey. Other questions that the survey will ask you, these are optional. So if you can get this data easily, it is helpful to CDC. They're asking what the average length of stay is for all of your short-term residents for 2016, as well as your long-stay residents. I would say this is a piece of information that most nursing homes do struggle to get, but remember that it is optional. Also, they're going to want to know your total number of licensed beds and also the total number of pediatric beds. For many of you, you do not have pediatric beds, but that is defined as a resident being less than 21 years of age. So once you have gotten that information, you are really ready to start entering your data into your 2016 annual survey. There are 2 options to do that. Often in an information system, there's more than one way to get there. The first being from the blue NHSN kind of home bar on the left, you can click on Survey and then Add. So we are now going to go back to NHSN. It's going to make me do it again. All right. So as you know, NHSN times out on you quite often. But this will allow us to show again how we're entering NHSN. So now we want to really complete this annual survey. So we can get to that point in one of 2 ways. You can go over here to Surveys and click on Add, and then enter the calendar year of 2016. Enter all the required information, and of course always remembering to click Save. Or we can actually click on this 2016 survey required box. That will take us directly into the annual survey. Yours should be blank, just as mine is. So all the fields that are marked with a red asterisk are actually required information to enter. Anything without a red asterisk, you can enter if you have it, but it is not required. So we're going to really go through each one of these fields, what the definition is, and that way you will know how to enter it. Okay? The National Provider ID first red asterisk box that's showing here will likely be the same as it was for 2015 unless you had a change in ownership. If you are unable to find that number or unsure of it, again, your state contact can help you with that information. And we need to fill out the facility characteristics section. So under facility ownership, if you look at the drop-down menu, you have several choices. Select the appropriate ownership for this facility, and you need to only check one. Is it for-profit, not-for-profit, including a church, government, or Veterans Affairs? So you can select one of those. Or certification, again, the drop-down menu. Is your facility duly certified for Medicare and Medicaid, Medicare only, Medicaid only, or state only? Choose the appropriate response. Complete your average daily census. Sorry, we missed the box for affiliation here. Again, drop-down menu. Are you an independent freestanding? You don't share a building, staff, or policies with any other healthcare institution? Are you independent, continuing care, retirement community? Again, not affiliated with any other healthcare systems, but is part of a campus containing other levels of care services. Are you part of a multi-facility organization or chain? Definition would be a facility that's part of the regional or national network of specialty facilities, where facilities share policies such as infection control, you share corporate leadership, and a common business structure. Are you a hospital system attached? So you're affiliated with the local healthcare system, you share policies, the facility is physically connected to the hospitals within the system. That differs from the last one being hospital system, but freestanding. So you are affiliated with local healthcare. Again, you share policies, but you are not physically connected to the hospital proper. Then we're going to put in our summary data for the 2016 calendar year. Again, we went over these definitions before. Average daily census, total number of short-stay residents, optional piece of information, what was the average length of stay for those short-stay residents, total number of long-stay residents, again, optional, average length of stay, total number of new admissions, means anybody that was admitted to your facility in the calendar year of 2016, and what is your total number of licensed beds as well as pediatric beds. Do we have any questions so far on what our annual facility is asking us to put in? Again, just a reminder, you can put them in the chat box.
I'm not seeing any questions come through chat.
Okay, so then we are going to continue. Facility primary service types. So it gives you a list of service types here. For each of those with a red asterisk, you need to first check under the column of do you provide those services in your nursing home? That's a simple checkbox. For the services that you provide on a given day, the day that you are filling out this survey or the day that you gathered the information, might have been the day before, what is the total number of residents that fall into each one of those categories? Some questions that we get from our nursing home is, what if a resident is getting more than one service type of care? Again, try to pick the most relevant type of care. The resident should only be counted one time in one of these service areas. Then we are going to move on to facility laboratory practices. Now, completion of this section may require assistance from your microbiology laboratory, so that's a good time if you don't know these answers. Many of these would be the same as the year before, but you want to make sure that the laboratory, when we get down to the type of, say, C. difficile testing that they run, that there has not been a change in the testing type This is an important required field because it does affect the relative risk when CDC figures out the number of expected cases of C. difficile that you might have for your patient population in your size facility running this type of test. All right. So the first question, does your facility have its own laboratory? For most of you, this is going to be a no. If it is a no, if you select no, then there's going to be another pop-up box that comes up that says if you don't run it in-house, essentially where do you send it? And there's a drop-down menu. Is it an affiliated medical center within your same system? Is it a commercial reference lab? Or is it a medical center contracted locally but not within your same health system? There is a note from CDC that if multiple laboratories are used, select a laboratory that performs the majority of your bacterial susceptibility testing. So where do you send the majority of your cultures to? We do run into this with many nursing homes where providers have a choice of where they send their laboratories to. So again, their helpful advice is that you want to select a laboratory that performs the majority of the cultures. Okay. Indicate whether your facility screens new admissions for any of the following multi-drug resistant organisms, or MDROs, and check all that apply. Now again, this would be active surveillance testing, such as swabbing the nose of a new resident for MRSA. Not a common policy in many of the facilities that we work with, but it may be policy in your facility. So if you do, they want to know, do you do it for MRSA? Do you do it for VRE, or do you do it for other multi-drug resistant gram-negative rods? And then if you answer yes to any of those, it is going to ask you how you culture. Is it a nasal swab, a wound swab? Is it a urine? Is it a sputum? Is it a rectal swab? So you'll need that information from your laboratory as well. Question number 3, what is the primary testing method for your laboratory? And we aren't going to spend time to go over these now. This is a question for your laboratory director. Again, it does affect how CDC calculates your relative risk, so you do want to have the correct answer in there. If your facility uses more than one laboratory, again, contact a laboratory where the majority of your resident samples are sent to get the answer to this question. Number 4, does your laboratory provide a report summarizing the percent of antibiotic resistance seen in common organisms identified from cultures sent from your facility, often called an antibiogram? So this would be provided by your laboratory. So yes or no, and if you answer yes, it will ask you how often. Again, if we were to put a yes answer in here, another question will pop up and said how often is it provided. Your choices are once a year, every 2 years, or other time frame. Now we're going to fill out some infection control practices. Question number 5, one that some nursing homes really struggle with, but my advice to you is don't spend a lot of time on this. You're really trying to estimate the hours per week that are dedicated, first of all, to all infection prevention and control activities in your facility. If multiple staff members are responsible for parts of the program, you're combining those hours per week by each person to get a total. Once you have that total, then you're breaking it down into the number of hours per week performing surveillance, which is defined as all program activities identifying and reporting healthcare-associated infections and the appropriate denominators, so kind of your basic surveillance. Then they want to know the total number of hours per week spent on other activities. These activities include, but are not limited to, things like education, prevention strategies, meetings, etc. So your A value plus your B value should add up to the total number of staff hours. Again, don't spend a lot of time stressing on this. It's very hard for facilities since you never really have an average week. So do your best with this one. Number 6, is it policy in your facility to use gowns and gloves And are they required for care of residents infected or colonized with MRSA? Is it for all infected and colonized individuals? Is it only for those with active infection? Is it those at high risk because of a wound, present of an indwelling device, etc., or no? So it's the same question being asked for basically 4 different organisms. So do you have, what is your policy for MRSA? What is your policy for vancomycin-resistant enterococcus, or VRE? What is your policy for CRE, resistant enterobacteriaceae? And what is your policy for ESBL producing or extended resistance in the other gram-negatives making up the Enterobacteriaceae family? So again, same questions for organisms. So complete those. 10 and 11 really deal with communication and how information is communicated when you receive and transfer a resident. So number 10 is when a resident is transferred from your facility to another facility, does your facility communicate their multi-drug resistant status to the receiving facility at the time of transfer? And so the directions indicate that we would select yes if it routinely communicates the status. So do you have a formal way to do this? Is it on your transfer report? And that would be a yes answer. Let me switch it up a little bit for number 11 and say, residents with an MDR that are being admitted to your facility from another healthcare facility, what percentage of time does your facility receive that information? Again, do your best estimate with those. And we're going to move on, and they're asking us about your antimicrobial stewardship practices. Number 12, are there one or more individuals responsible for the impact of activities to improve use of antibiotics in your facility? Hopefully that's a yes. There's at least one of you. But ideally this is something that's meant for more than one person. And so that if you check yes, another box will pop up and you select all that apply. Is your medical director involved? Do you have pharmacy involvement? Is your director of nursing involved? And other, typically, probably the most common one I see here is infection preventionist. So hopefully you have good support. It's not just one person, but they really are trying to track data on how much support the nursing home has to initiate these antibiotic stewardship practices. Number 13, does your facility have a policy that requires prescribers to document their reason for all antibiotics during the order entry? Again, if you answer yes, pop-up question is going to come. Is that adherence to that policy being monitored? So is somebody responsible? Do you get data on the amount of times? If you're requiring a reason for that order, do you get a report that tells you how often that is happening? Number 14, does your facility provide facility-specific treatment recommendations based on national guidelines or local susceptibility patterns to assist with antibiotic decision-making for common clinical conditions? So again, this is maybe a little bit more common in multiple chain facilities where you have guidance that has come down from your leadership, say a routine initial UTI is always going to be treated with this antibiotic. Community-acquired pneumonia, here's what we're going to start the patient on. So this is a yes or no question. If you answer yes, again, they're going to ask you if you're auditing it. Number 15, is there a formal process for performing a follow-up assessment 2 to 3 days after a new antibiotic start to determine whether the antibiotic is still indicated and appropriate? Think of this as an antibiotic timeout. So this is really shooting for a couple circumstances. If your provider has ordered a culture and started an empiric antibiotic, you have a formal process where somebody is looking at that sensitivity when it comes back to see whether the antibiotic that the resident was started on is the correct antibiotic. Is anybody reviewing whether it's the appropriate dose and duration? So whether this is your pharmacy looking at it, whether this is the charge nurse looking at the cultures as they come back. Also, some facilities have said they also have a process where if your resident goes to the emergency room for a non-infectious cause and comes back on an antibiotic, again, do you have a policy and procedure that lets you review those cases to see whether that antibiotic is actually indicated? Number 16, does a physician, nurse, or pharmacist review courses of therapy for specific antibiotic agents and communicate results with prescribers? Do you do an audit of feedback? So this would be, one example might be that your pharmacy can give you a report on how many residents were treated for UTIs. Were they treated with fluoroquinolones or another class of antibiotics? Does that information get to your providers so that they are aware? Again, if you answer yes, it's going to ask you what type of feedback. Number 17, does your pharmacy service provide a monthly report of antibiotic use, total number of new orders, the number of days of antibiotic treatment, etc. for the facility? Yes or no? Number 18, has your facility provided education to clinicians and other relevant staff on improving antibiotic use in the past 12 months? Again, yes or no? Does your facility have a written statement of support from leadership that supports efforts to improve antibiotic use? Yes or no? Hoping more and more facilities are able to answer this yes as we move further along in our process. This will be really imperative for the success of your antimicrobial stewardship product. Number 20, are antibiotic use and resistant data reviewed by leadership in quality assurance and performance improvement committee meetings? Yes or no? And 21, does your facility have access to an individual or individuals with antibiotic stewardship expertise? Now that can be someone in your facility, perhaps your own medical director or your own pharmacy support is trained in antibiotic stewardship, but it can also be a consultant pharmacist, a stewardship team at a referral hospital, an external infectious disease or stewardship consult that you might have access to. Again, yes or no. This information will be helpful for CDC. Again, they're trying to gauge how much support you do have for your antimicrobial stewardship efforts that we're going to be undertaking. We're almost done. We're getting to the end. The last question has to deal with if you have an electronic health record, what things are included in the record? Are your microbiology lab culture and sensitivity reports included in the electronic health record, or is that separate? Do you have to scan them in? Are they automatically there? Are your medication orders as well as your administration record part of your health record? Are your resident vital signs and admission notes? How about your progress notes and then transfer or discharge notes, or none of the above? Once you have all that information entered, you want to be sure to click Save on the bottom. I'm not going to do that here because this is a demo site and we want other facilities to be able to demo putting in a survey. Once you click Save, as with anything in NHSN, you should get a pop-up box that says that you have successfully entered your annual survey. You can also print that survey when it comes up. All right. So we are now going to switch gears. Once you have your annual survey entered, even though it says for survey year 2016, again, it's a retrospective look at what your census information was for the calendar year of 2016. That has to be completed before we can put in our reporting plan for 2017. So now we need to go in and put our January 2017 reporting plan in. Click on reporting plan in our blue NHSN home bar on the side. I think it's not going to let me, let's see, it wants me to save my survey, I bet. Usually it will give you a message saying, really, do you want to leave? So it's telling me what's required in my survey. So I missed the box. We didn't put in our affiliation before, but we actually want to not save that survey, although you certainly do when you want to complete it. And we want to add the reporting plan for January of 2017. So again, just like you did last year, if you've been in this since October, or if you are a new member, you would choose the month and the year from the drop-down menu. So we are going to demonstrate right now putting in the January 2017 reporting plan. You see that there's a box on top I just want to highlight because you do not want to check that box. If you inadvertently check that box which says that you're not going to follow anything for that month, it will not let you put data in. We have had facilities that have done that by accident. When you look at our screen, you can see it's sort of divided into three sections. Top one labeled HIA module. This is only if your facility has decided to enter UTI information. This is not part of the C. diff project, but you certainly are welcome to use NHSN to record your UTIs. You will be working in the center of this screen where it says Lab ID Event Module. And because this is a demo site, C. diff was already chosen here as a specific organism type. If not, you could choose that from a drop-down menu. In the future, when it's required to enter your CREs, you would also want to add your CRE here as your specific organism type. And then you always want to remember, again, to save at the bottom of the screen. Right? So if it lets us, the other thing I wanted to point out is that when you go to enter subsequent months, you can do the entire year, from January to December of 2017. You can do it this same way, do month by month, and actually choose C. diff from the drop-down menu. But there is a little shortcut button here that says copy from previous months. So when I go in and do February's, I'm going to show you how to use that. So we are going to save the January reporting plan. We've told NHSN that we are going to report facility-wide inpatient C. difficile testing. It's going to give you a message box that says Lab ID results must be recorded for 6 consecutive months for the same pathogen to provide meaningful measures. Do you want to continue? And you'll say OK. You're going to be reporting C. difficile data going forward. All right, and then you can see our pop-up box. Our plan was saved successfully. So now we want to go in and put in our reporting plan for February. Again, we want the reporting plan and add. We want to choose February from our drop-down menu. The year will be 2017. And you can see that the C. diff came up here. Again, a demo site looks a little different. Somebody had already put in a reporting plan, so I'm going to say we want to edit it so I can show you the feature I wanted to show you. And now you have this box where it says copy from previous months. That allows you to copy your reporting plan forward without always having to choose C. difficile from the drop-down menu. And then always click Save. So our suggestion is to go ahead and put in your reporting plan for the entire calendar year of 2017, and then that is out of your way. All right, so just a few other notes. We're going to stay in this NHSN view in case anybody has any questions. Another suggestion we have is it's really imperative that you have more than one person in your facility that has completed the process of obtaining their SAMS card. In the event of attrition or extended absence of a person who has a SAMS card, then that way the additional user, even if they aren't the primary person that enters information, they'll already have their SAMS card. Many of you have found out that it's not exactly a quick process. and they'll already be trained to enter data. So we really do feel it's important that each of you have more than one person in your facility that's ready to enter data. Again, your state contact can help you get started on that process. So we really now want to open it up to any other questions. We have about 15 minutes left. We can go back and look at our resources, or we can give answer any questions regarding mapping locations or entering your reporting plan. Have you struggled with adding an event or entering your summary data? And so I asked Christine, would you open up our phone line for any questions at this time?
Sure. Ladies and gentlemen, if you have a question, please press star, then 1 on your touch-tone phone. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. So once again, if you have a question, please press star 1 on your phone now.
For those of you that have been entering data for October, November, December, if you have any words of wisdom to those folks on the call who might be just starting out, we'd love to hear those as well. Is there anything that you found a little challenging or confusing until you did it the first time? Again, our goal is to really make this as easy as possible for you folks and reduce the burden as much as we can.
And we do have Sarah Warner. Please go ahead.
Hi. I am wondering if this PowerPoint and the notes from the speaker will be available. I have a new DLN here, and she was, she stepped into the office, and I just wondered if there's a way for her to review this or how to share this with her.
Sure. So if
I'm the only person now.
You're currently the only person. So
yeah, the other person
you try and recruit. So certainly if you are part of this initiative, you can go to the LSQIN website. These slides will be on there as well. If you need any more additional information about, the verbiage that was given, your state contact can help you out with that as well. So that information is there for you to share. If that's what it takes for you to sort of recruit some help, that would be great.
Yeah, because I just actually started doing this before she left. I got my SAMS card, and then now she's gone. So I did enter data, I think, for October and November. I have to get December's in there. But I need to, be able to, I have the book because I was involved when this all started, but it just didn't, I'm just learning.
That's a great question. And so the slides have been put into the chat box again, so you can find that link there as well. And the other place that you'll find it will be on the LSQN web page.
Oh, I see it. Okay,
sure.
Great.
Great question, though. But if you need any additional help from, and beyond that, just contact your state contact. They'll be able to help with that.
Okay, great.
Good question, Sarah.
All right, thank you.
And I'm seeing no further questions over the phone at this time.
Okay, well, anybody else is kind of thinking about their questions, I'm going to go back to our PowerPoint slides, and we'll just take a peek at some of those resources that are out there that we talked about. Forgive my screen jumping for a moment here. So on the LSQIN webpage, let's see if our link works. Okay. A lot of helpful information here. When I say contact your state contact, email addresses are all listed here. Additional assistance for SAM's desk if you have questions, for the NHSN help desk if you have questions. We put together a reporting guide and some FAQs, really summarizing material that we covered in our first three-part webinar series, but the recordings for those webinars are there as well. There are a series of short instructional videos on some of the key issues that facilities said they would like some help on. So we have a 6-minute video on resources, one on logging in, protocol definitions, mapping locations, how to put in your monthly reporting plan, how to put in a CDI lab ID event, how to put in your monthly summary data. So this is a good first place to go for a very short YouTube video. And you can also refer to our reporting guide and our FAQs. If all else fails and you still have questions, feel free to reach out to our state contacts. All right, so a question that came in. I just started with this initiative. Do I need to report from October through December, or can I start with 2017? So there's not a requirement to go back to October and start, but it would be helpful if you have that data handy to put it in, because it will be used by CDC in order to calculate that national baseline. So the more data that they have in, the better it will be. If you don't have access to your October through December data, go ahead and start with your January 2017. But again, even putting in your October through December data is good practice. You can always reach out to your state contact for help if you're not sure of how you're doing it. But as of this point, no firm requirement to go back and put in your October through December data. We'd really love you to do that if at all possible. Thank you for asking.
So, Diane, this is Sarah from Stratis Health, and we had a facility that attempted to do that. They didn't complete enrollment until 2017. And they weren't able to submit data for 2016 because of when they completed enrollment. So I think it's a matter of when you mean, if you just started, if that means if your facility just completed enrollment, you won't have the option to submit 2016 data.
That is correct. Thank you for clarifying that.
The other thing we wanted to point out here, in Minnesota, we've had a number of facilities that have submitted their C. difficile data for various months, but they're still getting alerts. And going back to the importance of that monthly reporting plan, so Diane pointed out that there are 3 kind of areas where you can indicate what you plan to report. If you indicate that you plan to report on the HAI module or on the process measures, then your data won't be considered complete for the month because NHSN believes that you're planning to report that information as well. So it's really important when you complete that monthly reporting plan that you only select the information that you plan to report. And if you're participating in this initiative, you'll be reporting C. difficile. We know that there are a few facilities that are reporting on other measures, but a majority of facilities in this initiative are only reporting on C. diff. So do not select the HAI module or the prevention process measure module unless you're very certain that you have that information to be able to send into NHSN as well. If you do it on an error, then you can go back in and edit your monthly reporting plan to deselect those options, and at that point, then the alerts that you're seeing on the front page will go away.
Thank you. Any other questions?
We do have another one over the phone. We have Cindy Rosen. Please go ahead.
Yes. Could you go over that one more time? For some reason I didn't understand. It was about lab events when we have a resident that goes to the emergency room or a clinic.
Sure. Let me just pop back to my slides. So this is one of the changes in the 8.6 version that was just updated. So if you have a resident who goes to the emergency room and then returns to your facility, same would apply if they go for a doctor's appointment outside of the facility and then comes back, but if during that time that they were at the ER, a lab test for C. difficile was taken and was positive, that is eligible for event reporting if it meets the rest of your definition, if it was an unformed stool, etc. So we just wanted to clarify that it isn't just sort of where the resident was physically at the time that that sample was collected, but where they are currently admitted. So they're still considered admitted to your facility even though they're going to the emergency room or an outpatient setting and returning. Does that answer your question?
Yes, and there's not a time frame with that. So if they went out to the emergency room, they just were gone, usually like 1 day or 2 days and then back?
If it's less than 2 days, it is still considered that current admission. So you would still consider that lab ID event if it meets definition. Because you may have a resident who goes and then stays for observation overnight, but CDC is using that less than 2 days does not meet a new admission.
Okay, thank you for that.
Thank you. Any other questions? While you're thinking, wanted to find my slides here. Just take a peek at the NHSN resources that are available as well. The table of instructions that I really used to walk us through the annual survey today is there. It is part of the C. difficile long-term care on NHSN. So you can find that link as well. So a question has also come in to report on January. What is the time frame that you want reported? So January data would not be able to be put in, the monthly summary data would not be able to be put in until after January 31st. Because that needs to know the number of resident days, the number of new admissions, etc. Once you have your annual survey in now and your reporting plan in, you can enter a positive event at any time during January. Does that answer your question, Rachel? So a lot of helpful resources on the NHSN webpage. Thank you for asking, Rachel. I'm sure if you had the question, other folks have it. So under specifically surveillance for C. difficile, MRSA, and other drug-resistant infections on the NHSN webpage, we're going to click on the long-term care. And you do want to make sure that you're in the correct section here because directions can be different, definitions can be different depending on the care setting. So under long-term care, if you have questions about the C. difficile module, as we're winding up here, we have about 3 minutes left. So if anybody has any questions, feel free to put them in. So there are many materials here under training, protocols. We have questions about definitions, etc., data collection forms, and here's the one that I used today was the annual survey for long-term care. So we updated in January 2017. Again, a good way to print out a hard copy first so that you can collect all your data. The one right below it here is the table of instructions. That explains each and every entry, what the definition is for it. That's what we went over today. So another good resource for you to have as you get ready to enter your 2016 annual survey. If you think of questions once we're done today, again, remember to contact your state lead. I'd be happy to help you. Got a few more minutes here. Anything else that anybody has struggled with that you're not sure of? Any other questions we can help answer for you? Again, these are a couple of great resources for you to use as you're getting ready to do your survey. It literally walks you through what is meant by every one of those data fields that you have to put in. So I definitely suggest that if you have any other questions, that's another good resource for you to use. So maybe another reminder as you think about getting someone else in your facility, signed up so that getting them enrolled to get a SAMS card so they can enter data. All of our training sessions have been recorded. They're all on that LSQIN webpage. So that's a really great way for that person to sort of catch up on training to where you all are now. We try and make everything available to you so that you can give it to somebody else in your facility so that they can look at that training as well. New people coming on board, again, if you're having troubles, any questions, contact your state contact. They're happy to help you. We really do want to stress that it will be of great advantage to you to have another person with their SAMS card able to enter data for you. It also never hurts to sort of let your leadership know what this entails so that they know how much work you're putting into it as well. So some of these documents are really good for them to see. And we have reached the top of the hour, so I just want to thank everybody that's been on the call today. We hope that you found them helpful. When you close out of today's webinar, you will receive a link to the survey, evaluation survey. We really want you to fill that out. Let us know what you still feel you need help with, what you found helpful, any other suggestions you might have for us. We do value your input. Thank you all for attending today.
Thank you. And thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.